What is epilepsy? Epilepsy is a disorder resulting in recurring and sometimes life threatening seizures from abnormal activity in the central nervous system located in the brain. This happens because of the irregular behavior of damaged brain cells that results in changes in awareness, muscle control, emotions, and behaviors. A cause of epilepsy include abnormal activity occurring in the central nervous system. The brain's electrical rhythms become disturbed and imbalanced from the normal electrical pulses that occur. Risks that lead to seizures include stress, insufficient food take, alcohol use or drug use, insufficient sleep. Epilepsy becomes more common after traumatic brain injuries. Because the brain is scarred from the initial injury, seizures quickly follow as a result. This causes post traumatic epilepsy, seizures caused by or occurring after brain trauma. Seizures. A seizure is a sudden uncontrolled electrical disturbance in the brain. A seizure can affect your body movements and level of consciousness. Types of seizures seen in epilepsy are generalized seizures and focal onset seizures. Generalized seizures begins with widespread electrical discharge involving both sides of the brain. These are more likely to happen through genetics. Some examples are absence, tonic-clonic, and tonic-clonic seizures. Focal onset seizures are electrical discharge occurring in only one side of the brain. Seizures arise from limited areas of the brain. The difference between these two is that focal onset seizures only occur on one side of the brain, while generalized occurs on both. Who can get epilepsy? All people are vulnerable to develop epilepsy, but it is most commonly seen in the young and the elderly. New cases are seen in younger children, particularly within their first year of life. After the age 55, cases proliferate as the elderly develop strokes, brain tumors, Alzheimer's, and etc., all of which can cause epilepsy. 3.4 million people have epilepsy in the US. 1 in 26 people will develop epilepsy in their lifetime, and out of 1,000 people, at least 6 students would live with epilepsy. Here are some things to do if someone is having a seizure. The key point we want you to understand is that seizures do not usually require emergency medical attention. Only call for help if these happen. If the person has never had seizures before, they cannot breathe or wake up, the seizure lasts more than 5 minutes. Another seizure starts after the first, they become injured due to the seizure, or they have another condition that may put their life at risk. If seizures happen, this is what you should do. Stay with them until they become conscious. Help them sit up and explain what happened once they awake. Keep yourself and others calm, and also check for medical bracelets or emergency information. For generalized tonic-clonic seizures, which are also called a grand mal seizure, this is the type of seizure most people would think of when thinking about a seizure. The person may shake, jerk, or fall. What you can do is ease them to the floor and turn them on their side for easy breathing. Get them away from anything that could cause injury. Put something soft under their head and remove their eyeglasses. Loosen ties or anything that may restrict airflow. And roughly time the seizure. Call 911 if it lasts more than 5 minutes. Here are some things not to do. Do not hold them down. Do not put anything in their mouth because of choking hazards. Do not give them mouth to mouth CPR. And do not offer them water or food until they are alert of what has happened, again for choking reasons. Thank you for listening.